Okay, welcome everyone to the Future of Mental and Behavioral Health. I'm Bambi Francisco Royson. I'm one of your co-hosts. So this is our second virtual breakout session, part of our 4-part series of this virtual Future of Mental Health program. It's typically at UCSF, and unfortunately during the shelter in place, we've had to go online, but we've broken it out to 4 sessions. So hopefully you'll enjoy this one. We broke them out to different sessions, 90-minute sessions, to allow our speakers to have more time with our guests. So if you're participating, please do have questions. You can go ahead and post them in the Q&A section, or around 4 o'clock, you can raise your hand and we will unmute you and you can ask your question live. So before we start, I want to recognize the producers of this event, Vader, UCSF Health Hub, and HP, but also our sponsors and partners. So Avison Young, which is a commercial real estate company, Advisor, a boutique investment bank, StratPoint, which is an outsourced engineering company, as well as Scrubbed, a back office online accounting firm, and BetterHelp. And BetterHelp provides virtual therapy. And thank you, BetterHelp, for offering services to the Vader and Invent Health community. So if you use the code VATOR, V-A-T-O-R, to BetterHelp, you can get 3 months of BetterHelp therapy for half off. So thank you, BetterHelp. So it's April 22nd. We are 5 weeks into this shelter in place, at least in California. And through this time, we've all had to make sacrifices and disorienting adjustments. But for some of us, I think this has been a time to liberate us to the present, which is a good thing. So we can kind of rethink what's meaningful in our life, what's our purpose. A lot of things that we take for granted, I think, have come to the forefront and actually are providing a lot of meaning for us. So that's a silver lining. But as I think about us moving outside of this phase, and as the economy opens up, I wonder if we're going to be able to adjust. And I saw something recently that talked about a new pandemic, a new silent pandemic, a mental health one. And I think the authors were concerned that as we move out of this current normal into a new normal of uncertainty, there's going to be a number of cases of stress and anxiety. And I wonder if we're prepared for it, if our mental health system is prepared for that. So I would really like to explore that, and hopefully we can dive into that. Our speakers today are Eva Borden, Managing Director of Behavioral Health at Medical and Medical Solutions at Cigna. Todd Zartowski, he's the Chief Executive Telehealth and Chief Medical Technology Officer at Providence St. Joseph Health. Billy Deitch, investor at Oak HCFT, and Dr. Claire Purvis, Director of Behavioral Sciences at Headspace, which offers guided meditations. So with that, I'd like to bring in my co-host, Dr. Archana Dubey and Mark Goldstein, to say a few words.
Archana,
you want to begin?
Oh, I'll bid it. Sure.
Yeah.
Welcome on behalf of UCSF and UCSF Health Hub. Sorry, we're not doing this in Mission Bay, but this is the second of the Vader series, and it's going to be even better than the first. For those of you who don't know UCSF Health Hub, we are innovation hub for UCSF, focusing on digital health. One of our areas of focus is mental and behavioral health. So this is a very timely webinar. We do a few things at Health Hub. We put on the Digital Health Awards, witness back. We have typically a number of events on campus, and we also match advisors, investors to companies and clinicians, and for people that they need to help with. So if you're not a Health Hub member, become a member. Go to ucsfhealthhub.com, and I'll turn it right over to Archana, and I look forward to the event.
Thank you, Mark. I am a physician, Global Medical Director for HP, joining in and welcoming each one of our panelists. COVID-19 as being the global medical director for a global company, not only brought in the physical health to our highest priority, but also mental and behavioral health. Because overnight, companies like me, like mine, became virtual, and suddenly people needed to figure out how to live with their families, with several uncertainties around jobs and access to care, access to mental and behavioral health. So I'm really looking forward to talking to each one of you to see how you're tackling this virtual world and mental behavioral health, which is such a human connection space, and navigating these times and supporting them in each one of your venues. So with that, it would be great to kind of hear from each one of you, what is it that you do in your day job in a way, maybe today in the current state, and then what are you seeing, how is each one of your organization gearing up to handle some of the mental behavioral health dilemma around COVID-19 and beyond? So should we begin from Eva, because you're on my screen, on the first one on my screen.
Perfect. Hi, everyone. I'm Eva Borden, and my main focus for today's conversation is I lead the behavioral health solution and strategy area for Cigna. And so if I think about what my day job's goal is, it's to provide and meet the most common concerns of our clients and customers, which are, I need access to behavioral care in a timely and easy to navigate way. And that existed pre-COVID-19. And so post-COVID-19, we're actually seeing, I think one thing, one of our leads of behavioral health, one of my clinical partners always says, she said, COVID-19 is a medical condition. And so it starts with, and we have these epidemiological curves that we can follow, and we can understand who's hospitalized and who's not. But I love the comment earlier about this silent pandemic of what's going to happen and what are the underlying ramifications of keeping people alone and isolated. So when I think about, for example, some work that Cigna had done, we've been focused on loneliness for years. And so we did a study in 2018 and followed up again in 2019. And if you think about in a pre-COVID world, we were reporting that 3 in 5 Americans, 61%, reported that they were lonely. And that was a 7 percentage point increase from the 2018 findings. We were also finding, and so think pre-COVID world, for workers that were lonely, they believed that their work, 12% of lonely workers believe that their work was lower quality. And this is the part that I think in a post-COVID world really makes an impact is remote workers were more likely than non-remote workers to always or sometimes feel alone. And so if we think that we had this situation happening before COVID-19, now imagine we've isolated people. They are all working, not all, but many, many are working from home. And now there's added anxiety, stress in a number of different areas. And so how do I think about how this practically has changed my day job? I would say from a beneficial perspective, the demands of COVID-19 has largely accelerated Cigna's strategy to get access, getting our customers access to timely behavioral health care. There's really 3 things that I think of that have accelerated that strategy post-COVID-19, which is number 1, a really strong push to providing virtual behavioral care. It was something we already believed in, and now this simply accelerated the adoption, which has been great. Expanding adoption and coverage for getting that emotional counseling. I don't need to wait for visits that are going to diagnose me with depression and anxiety, but there are visits that are available just to help deal with emotional concerns that you have. And then 3 is increasing the access and the availability to digital tools. I may not be someone who wants to have, or can even right now, have a face-to-face conversation with someone, or I may not be ready to do that, but there are digital tools out there. And I think some of my other panel colleagues will probably highlight some of that. So I think one of the things is, if I just kind of rewind quickly and say in a pre-COVID-19 world, We had a long, strong push for behavioral health needs. I think in a post-COVID-19 world, it's only accelerating that, and we need to be responsible for making sure that we have access to timely care in a really easy to navigate way. So, thank you.
Thank you. This was really well organized and quite pointed answers, and I love that. So thank you so much. On my screen next is Billy. So if you can share from an investor perspective, what are the things you're starting to see being successful in your current investment, and then what you're focused on as we go forward?
Sure. So just quick background on myself. So I'm an investor at Oak HCFT. We're a venture growth equity fund with $2 billion of assets under management. We invest in fintech and healthcare companies. I spend all of my time on the healthcare side. I lead our San Francisco office out here on the West Coast, and we've got folks based in Boston and Connecticut as well. And on the healthcare side, we invest across healthcare services and healthcare technology. And, you know, I think in every way, all of our companies have felt, you know, the impact of this, obviously, right? You know, and the people at my firm, right? I'm working from my home office, and the nice thing for my mental health is I'm petting my dog as I'm talking to you because she has her head on my lap. So there's some mental health relief, I suppose, that I don't normally get at work. But, you know, I would say thinking about our portfolio a little bit, and on the behavioral health side, we've invested in companies like Quartet, Axial Healthcare, US Health Vest, and Emilio Health, which is a newer venture focused on pediatric behavioral health, and a handful of other companies over the firm's history. You know, we are seeing, you know, many of our companies, right, are providing healthcare solutions right on the front line of the COVID-19 crisis. And, you know, those could be primary care folks or folks delivering care at home, or some of the behavioral health providers that I mentioned. And I would say, you know, all the companies are certainly defensively focused on managing headcount and managing expenses and cash preservation. But I think there's also, you know, an offensive focus on how can they be nimble and innovate on their product. And I would say, you know, overall, this crisis is a bit of a galvanizing moment for our management teams to persevere and prevail as a team. And I think, you know, we feel confident that they'll emerge stronger from the crisis. But there's a lot of, you know, adapting. And I think one of the really interesting things we've seen, and this sort of gets to Ava's point, is, you know, digital health was, or excuse me, virtual health care was on the roadmap for a lot of our companies. And that's been accelerated in a massive way. And there was all this talk about, well, you know, we'd have to do this and we'd have to do that. And now it's saying, well, we have no choice. We have to launch the product. And they're launching it and it's working. And so I think it's, you know, it felt riskier. Well, should we launch it? Should we invest behind virtual care? And now it's saying, well, we have no choice because it's the only way that we can see our patients. And it's sort of forcing us, these companies, to innovate, and it's really paying off. So it's been interesting to see. I mean, there's certainly been hard choices that have had to be made, but I think there have been some silver linings for many of our companies. Sort of like my silver lining is my dog at home. So everyone has their silver lining.
And your Peloton back there. I
yeah, exactly. That's a fake Zoom background. I don't actually own that or use that.
You should have been on the conference with the Peloton.
Yeah, exactly.
Product placement right there.
Yeah.
Claire, you're next on my screen.
Sure. Yeah, so I'm Claire Purvis. I'm a clinical psychologist by background, and I lead behavioral science at Headspace, which is a mobile app that provides guided meditations, is what we're known for, and that offering we kind of think of broadly as mindfulness and ways that mindfulness can show up in your everyday life right now across both meditation as well as sleep and movement. So I can speak a little bit about, you know, kind of how we're thinking about the current situation, and then some of the responses that Headspace has made to try to address what's going on. I want to really echo what Eva was saying, that certainly, you know, as a clinical psychologist, it's in our field, it's long been known that mental health and social isolation, these are longstanding issues. These are not new problems. But I think one to think about happening is that, really given the significance of the global crisis that we're going through, these chronic and acute stress is activating some underlying vulnerability for a really large segment of the population, and is introducing kind of new stress to all of us. So in clinical psychology, we often talk about the biopsychosocial model of mental health concerns. So essentially that in many cases, many people have an underlying biological and or psychological vulnerability to depression, to anxiety, to addiction, et cetera. And it's the interaction with that in our environment, the context of our lives that really activates that underlying risk, right? So a common way of explaining this is that biology may load the gun, but the environment pulls the trigger, right? And so when we think about this changing context that's going on in all of our lives globally, the COVID-19 crisis has disrupted a lot of those healthy routines and social connections that billions of mental health. And it's really a significant risk factor worldwide for mental health problems. Folks have already commented on kind of these long-standing issues of difficulties with access to high-quality mental health care. And I think we can certainly anticipate that some of the consequences like insomnia, acute stress responses, as well as some longer-term mental health consequences will persist long after this pandemic has stabilized or passed. So we think about technology really as a facilitator of access. That supply and demand balance with fully trained, licensed mental health professionals like myself and my colleagues, there will never be enough of us to meet the demand one-on-one for mental health services. And so there is a well-established research, as Eva was talking about with digital therapeutics, that shows that self-help and digitally delivered mental health interventions can prevent and treat mental health conditions. So, you know, at Headspace, we're not a mental health treatment platform, but we do think about our role in helping to buffer against stress and potentially preventing progression or worsening of existing concerns. And I'm happy to kind of speak more about that as we continue, but I'll just mention a few things that we're seeing in terms of COVID or some of our responses for the time being. In a nutshell, I'd say right now at Headspace, we are heads down focused on making Headspace available to more people and to as many people as we can. We're working closely with global NGOs, with health systems, with government officials to set up ways to make Headspace widely available to people who need it. And we know that people are experiencing you know, really elevated levels of stress. We're seeing huge upticks in the amount of people coming into the platform and accessing kind of a special curated set of content that we've made freely available called Weathering the Storm. This is mindfulness content in the app that's for people really to help buffer stress response and alleviate stress during this time of crisis. And we've released that in a number of different languages to kind of serve our global market. I think, you know, to zoom out, I'd say one way we can think about the role that Headspace is playing in this is that, you know, we are here to help, and mindfulness we see as a helpful way to step away from a lot of that kind of anxious chatter or that sort of stressful cycle that we might get caught in, and many of us are experiencing as a result of kind of this really unprecedented situation that we're facing. So certainly making that, you know, expanding access to the content that we provide, and then creating some kind of new custom content to try to address contextually what's happening for people is, I think right now, largely our approach to supporting folks as they're really trying to adjust to a totally unprecedented and stressful situation.
Thank you. Todd, how are you addressing COVID-19 and the stressors of those in your environment? And knowing with your technology background, are you utilizing some technology tools and other things that could be useful in responding to it?
Yeah. So first, a little bit about my background in the organization, and then I can talk specifically about our COVID response. So I'm a neurologist by training, and have overseen telehealth for about 3.5 years for Providence. And Providence is one of the largest nonprofit health systems in the United States. We have 51 hospitals in 7 states and over 1,000 clinics, mostly on the West Coast, but also in Alaska, Montana, and Texas. And in the telehealth space, we've been active for about 15 years. And across the care continuum, a lot of work in the acute care space, including around behavioral health. But more recently, we've expanded our clinic footprint, home monitoring, and direct-to-consumer offerings. And just to give you a sense, in sort of scope, so we last year did about just under 100,000 virtual visits, face-to-face virtual visits for the year for our organization. And so it works out to be maybe a little under 300 a day. And by the third week in March, when COVID had really kind of solidly established itself on the West Coast, we were doing over 10,000 visits a day. So we've seen a little bit of an uptick, and across the board, but in particular in our clinics where people can't get to the clinic, and so we've had to convert traditional face-to-face visits to initially phone calls and then video visits to care for primary care, specialty care, chronic disease management, behavioral health needs, things like that. The one area that I think is worth calling out, something it really resonated, I think the comments that Eva made about kind of multi-pronged approach to mental health and behavioral health, is about 2 years ago, our own health plan came to us and said, we don't feel like we're doing a great job of caring for our own providers and caregivers, particularly when it comes to stress and burnout. And can you guys, you've done all this stuff in telehealth, can you build us a platform for behavioral health? And so we did. We spent about 18 months standing up what we call Behavioral Health Concierge, and we launched it last June. And it really has, we started in the Seattle area and then spread across Washington, and now we're in 5 states. And it really has taken off in a way that we didn't predict, even pre-COVID, I would say. So we started out with about 100 patients the first month. First full month was July, and we were doing over 200 by the end of the year. We had done over 1,000 for the last half of 2019. And the most interesting thing about it was 21% of people that were using the service were physicians. And, physicians are notoriously difficult to get to ask for help. Just ask my wife; she'll tell you I'm a classic example myself. And so the fact that we could get that degree of engagement from our docs, and part of the trigger for this was we had some suicides, we had burnout scores 50 to 60%, just like the rest of the country, and that seemed to be getting worse, not better. And so just availability of an on-demand service that could move kind of the traditional experience of you call a number and you get an appointment. On average, our response time was about 8 days to when you could talk to someone. And if you think about like being in crisis or having a really bad shift in the ICU or the ED, and the response is, we'd love to talk to you. The first availability is 8 days from now. You can imagine why our scores weren't great and why we felt like we weren't addressing the need. So we were able to basically reduce that down to 0 days. So by launching an on-demand service that's led by counselors, not psychiatrists, as the kind of the tip of the spear, we were able to see about 65% of patients same day, or caregivers same day, and then 100% of patients, essentially 100% within 48 hours based on their preference. And we had a net promoter score that's been consistently, I think it's 88 now, but it's basically, high 80s, low 90s. So our caregivers love it. And so we've seen a real, not surprisingly, a real uptick in that in the setting of COVID. And we've built a few tools around it using some digital tools, as was referenced. So super helpful to layer that in, to give people an option to do self-service, if you will, talk to someone or be referred to see a higher level of care when necessary. And we're looking at how to wrap that into a kind of a more comprehensive package so that You can kind of meet people where they want to be cared for, how they want to be cared for. But our initial focus has been, what we call caring for our own caregivers.
Well, it sounds like that article that I brought up talking about this silent pandemic and the mental health system not being prepared would be inaccurate based on the conversations here, where it sounds like everyone here has been pretty much prepared, and the technologies you've had in place, they're just now being utilized more. So you've sort of already been prepared. Todd, you launching this last year, and Eva, you being pretty well prepared and waiting for, not this moment, but you've been waiting for some acceleration. We're going to talk about innovation and the new technologies, but I want to talk about the stressors that everyone has somewhat touched on. Eva, you've touched on social isolation or loneliness. 61% of people are already lonely in the country, whether we're seeing an increase in that. And then whether, say, for Todd, you're caring for providers, is it just burnout now, or is it something else? Are they worried about their jobs? And then for you, Billy, what are your startup entrepreneurs worried about? Are they worried about, homeschooling their kids while thinking about not running out of money? What are some of the stress points you're seeing with either your patients or with the companies you work with, in your case, Billy? And this is for everyone.
So this is Eva. I'll go ahead and get started. So we haven't, the study that we did was in 2019, looking back into 2019, so recently released. We haven't completed a new loneliness study yet, but if I look at other indicators to say, how should we be concerned about the population? One of the things through our partners at Express Scripts, we really looked at how has our pharmacy utilization changed as a result of COVID-19. So for the 5 years prior to 2015 through 2019, there was actually a decline in anti-anxiety medication and anti-insomnia medication of about 12% and 11% respectively. So think over a 5-year time period, we saw these drugs decrease. In 1 month, from February, and I just want to make sure I get the dates right, mid-February to mid-March, so through the first week of the COVID-19, where everything started to get more intense, shelter at home, et cetera, we saw a 34% increase in anti-anxiety medication. Oh. And so that's really just trying to put hard numbers on what are we seeing and how are people responding or trying to cope. One of the things, and I actually really appreciated some of the things that Todd said, because as we think about helping people, I think there are a few different pieces. Number one, there's 3 different groups we try to help from a stakeholder perspective. One are our customers. So how do we help the people who are calling in? And, as they call in, there's a number of factors that we're actually dealing with and addressing. Things from, my child was getting applied behavioral analysis to treat autism. I can't go anymore. How can I get virtual care? Domestic violence. I need help. What can happen? What about my food concerns? A very common one that happened early on was AA, NA, making sure that there were virtual meetings. And so just the cultural pieces of those stresses, it wasn't, I need therapy. It's, how can you help me for all the things I was already accessing? How do you help me get into a virtual care setting? So that was one of the early things we saw, as well as even in the first week, I think it was a well over 20, somewhere between 20 and 30% spike in people calling us to say, can you help us find childcare? So that's really our customers. Our clients and employers are saying, how can you help my people? And so a lot of it started out with, how can you help me respond from a medical benefit perspective? How can I make sure my people are covered with virtual care? It's actually progressed on now. If I'm laying off and furloughing people or things are happening, how can you help me? I'm worried about the stress in my population. And then finally, Todd identified it beautifully when he talked about the stress of the healthcare provider. We had one provider group, so there's a lot of times that will actually be the person, that group providing coverage for medical or a medical provider. We had one hospital that was on the front lines who called us and said, we need your help now. our physicians are showing signs of PTSD and we need help now. And so to your point, Todd, one of the most important things we could do is make sure they knew we have coverage, access to counselors 24/7, 365. You do not need to wait. You can pick up the phone and get help right now. And so when I think about the stressors, you know, a lot of these things, kind of like Claire was referring to earlier, could show up in behavioral health needs, but we're finding very base level needs that are showing up between our customers, our clients, and our healthcare providers.
Yeah, I would just echo that. You know, Eva, PTSD is, we're seeing that, and part of it's the nature of this disease, right? So dying from acute respiratory distress or respiratory failure is not a pleasant thing, and seeing, you know, for frontline caregivers, nurses, and physicians, seeing that multiple times a day, day in and day out, just takes a toll. Lack of PPE, stress around not having enough masks and protective equipment has been a big stressor, and so one area that we've done on the acute side, it's not necessarily specifically a behavioral health piece, but it's sort of under-recognized, I would say, and that is for patients who are in isolation, who can't see family, using digital tools, and in particular using virtual visits, we've been able to do a couple things. We've cut down on the use of PPE by 50% per hospitalized day per patient. So less people going into the room, gowning up each time you go into a new room, using a new set of gloves and gown and mask. And so having, you know, using it as a way to preserve PPE for serving more patients. And then the other is, ironically, it's actually more, we can connect better with patients by using a virtual visit like we're doing right now, from outside the room, when I'm not wearing a mask and I'm not wearing a gown, and I don't look like an alien. If you're sitting in a room by yourself day in and day out for a week, 10 days straight, and the only thing you see is someone who's in protective equipment head to toe, it's a very isolating feeling. And so provisioning them with you know, a tablet and the ability to connect with family members and their nurse who's on the other side of the you know, of the wall, but is not covered in protective equipment, can actually really help that sense of isolation for these patients.
Todd, you have over 800 clinics, 50 hospitals. Have you had to shut down those clinics? Have you had to move staff around? I mean, that can be disorienting, but I've seen that with a number of different clinics and hospitals.
We have. So we, you know, we're in the States, and of course, almost every state now has shelter in place rules. So we have shut down lots and lots of clinics, and we've converted providers to virtual providers. So we, 4 weeks ago, yesterday, we turned on over 7,000 providers in one day to be able to be telehealth providers and do virtual visits. And it was because of that exact reason. Patients, you know, they couldn't serve patients, and so we had to basically figure out how to scale that in a rapid fashion. And what's interesting about that, I'll just share, is that we had a lot of providers who historically had zero interest in telehealth and virtual care. In fact, we're antagonistic about the whole concept, and now are suddenly sort of knocking on our door saying, why can't we get this faster? Because they weren't able to care for their patients the way they have for the last 20 or 30 years.
Okay. So they're occupied. All of your physicians are occupied. So loss of job or sense of purpose they haven't lost the sense of agency because they don't have work. So everyone is fully deployed.
Yeah, I would say our volumes are down. We're not where we normally are in the normal state, right? So I don't want to paint an overly rosy picture, but we've been able to maintain providers seeing their patients both in primary care and specialty care to an extent that they never would have been able to do without having tools. So it's the volumes are down overall if you look at it, but it's it's been a very valuable tool to be able to keep not just the providers, but the office staff employed and engaged. And we're hoping, you know, my hope is that when we get through this, we actually land somewhere in the middle where we have in-person practices complemented by virtual and digital tools, which is what we've been pushing for a very long time. So we're kind of trying to push to make sure we don't roll it back into purely bricks and mortar types of services that, frankly, I think most patients, my hope is as we get through this and they see the value of it, both providers and patients are going to demand it, that it's supported. And frankly, I mean, the payers have been really supportive as well. So.
Yeah,
I think
that genie is sort of out of the bottle, Todd, and I completely agree with you. I mean, we're seeing it all of our companies that that hybrid model was on the roadmap, and some were already going digital, you know, virtual first, and it's just happening everywhere. And I think it's just going to accelerate. My wife is a clinical psychologist, and she's in the room next to me, actually doing a video session as we speak. So I'm even seeing in my own home, but at all of our companies. It's happening, and so I think you're right, and the patients are enjoying. I mean, I bet a lot of people on this call. I certainly have. I've done virtual visits, and it's great, and I think it'll just continue.
Well, not to mention everyone has Zoom on their computer now,
Right?
even our kids. But Billy, so how are it was interesting. I had a call with somebody from an accelerator asking me to, you know, create some sort of forum to enable their startups to speak to therapists, because they're dealing with just so many issues, you know, couples therapy, because they're 24/7 now around their wife, or having to be a homeschool teacher while they're, you know, cooking, you know, making lunch or something like that. So what is it that your portfolio entrepreneurs are struggling with,
Yeah.
and how are you supporting them?
Yeah, I mean, well, I'd say, like, I've always admired the CEOs that I know and talk to and work with, at the amount of stress that they are able to manage day in and day out. It is an incredibly stressful job. Whether your company is doing great or not doing great, it's stressful because you're responsible for the lives of many, many people and the livelihoods of many, many people. So you're going from a position of stress, and like all of us, we're all feeling incremental stress right now because things are so unclear. There's so much, you know, uncertainty, that I think that level of stress has gone up. So, you know, I don't want to generalize, but I would say you see everything for the CEOs who already had stressful jobs. It's just increased, right? And so that could be for a company that's struggling and they're thinking about furloughs or closing clinics for a time being, which is really tough decisions to make, and you're not sure if it's the right one. Even companies that are doing great, like, you know, Claire was saying, Headspace is really getting a lot of traction. I'm not surprised by that, but things start to break at the seams a little bit when you unexpectedly take off. You know, you talk to people, like I know folks at Zoom, I mean, they're feeling, you know, pain points here. So I think there's stress that comes from that. You know, CEOs of companies where they're delivering care, and this is sort of what Todd was getting at, but you're thinking about the well-being of the providers, and you know, they have to deliver care, and or do we have the PP&E? And it's one thing for, you know, a large health system or even a smaller health system, but if you're a sort of startup care delivery business and you've got to source PP&E, you don't have the clout. I talked to a CEO and they were cutting gowns from sheets of plastic for their providers, and it was a bonding moment for their company, but really stressful, right? They had to make sure that they could deliver the care, but keep their people safe, which is their number one responsibility. So I think, you know, to your question, Bambi, it's just the stress is really acute. And I think there's also a focusing that's happened, which has been great to see. But, you know, people are stressed just like the rest of us. You know, you've got kids at home and, you know, in Cleve, and it's stressful. So, you know, yeah, I think there's just the same thing we're all feeling, but maybe just amplified in some ways because of the amount of pressure they're under and amount of people they're responsible for.
So Claire, how do you take sort of I'm sure you have you're pretty data rich, but you don't have therapists who are sitting down and interacting, engaging with your members. So where do you see, how do you even categorize stress points or categorize what if they're stressed out about, parenting issues or work-related issues. It sounds like you're funneling them all into that one big one. What was it? What did you call it? It's some sort of.
We have a curated collection of content that's available for free to everyone right now. So we certainly see, you know, that's one way that we see kind of an indicator of the type of stress people are facing is just the amount of volume that we see coming into that curated free offering. There are a couple ways that, you know, at Headspace, you're right, we do a lot of data. And there's a couple ways that we've approached kind of understanding what people are going through right now and how we might meet that need. One is just kind of your basic, you know, looking at some of our usage data. So we've seen a 14x increase in the number of people that are completing kind of our general stress meditations. So this is where you come into the app and you can really, you know, you can choose the type of content that you're looking for, the type of presenting concern that you're looking for help with. And so that's one area where it's just a general piece of content that we're seeing a huge increase in. And then we also recently released some mindful movements, and we're seeing about a 12x increase in the number of people coming in to use one of our at-home workouts that's specifically around reframing anxiety or kind of de-stressing. So we're certainly seeing people engaging in this contextual way where they're certainly looking for content that's to meet a particular need state. But other things we've done is really go out into our user base and do some qualitative research. So we're lucky to have a design research team that are excellent qualitative researchers, and they've gone out and done both surveys and interviews with a number of our members. And we've seen, you know, a lot of the themes that have come up. I don't think there's, you know, some big surprise that we've unearthed, but this shift from, you know, being kind of oversubscribed or rushed or busy in the day to a totally different context of being at home with a different set of stressors. We've seen a lot of resonance around that. Certainly, I'm actually tempted to pull up those results right now to kind of give more of the details, but kind of, you know, we go out and we talk to our members to understand just kind of at a richer level, what does the COVID-19 crisis look like in their lives? And this will inform, you know, I think one thing we know about digital interventions is that really contextualizing that to the experience someone is in is obviously the most value for that person, and certainly the best way to deliver an experience that's going to be something that they come back to, something that's helpful to them. So we want to understand in their own words, you know, what does this health crisis look like? And then that will feed into our product and content development process to create either kind of one-off experiences. We have a daily kind of inspirational video that plays in the app. It's not intended to be, you know, teaching anyone to meditate, but that's been really based on what we've learned from people about the types of experiences that they're having, and then creating content to sort of ease or address some of that. But I think in general, you know, I echo what folks are saying. I think one thing we're seeing from a mental health perspective coming out of the current crisis is that, you know, digital health tools and technological tools to extend mental health care, that's not likely to go anywhere. It's not likely to go away after this, right? And so one way that I tend to think about it is how this might help to lead to more dissemination of a stepped care model where, yes, there's extended access to that face-to-face care via telehealth, via virtual visits, but also the full spectrum of levels of care that can be accessed with ease and navigated simply. And Headspace right now, you know, we fall into more of that category of providing prevention, stress relief, kind of helping to prevent problems from exacerbating when they're really at that more subclinical or general level. And I think I see some hopefulness in how the healthcare system is responding to this, that really there's this increased belief in the importance of scaling out a digital stepped care model and being thoughtful about the ecosystem of tools that are provided to people to address need across levels of severity. And I don't think that's going anywhere.
I think you touched on a number of things, and you also talked about creating new services. And I think all of you on this panel are thinking about how do we create and shape new services that people might need. Billy talked a lot about silver linings and some positive aspects that this situation has created, which, you know, whether it's sort of galvanizing us or liberating us to the present, making us more motivated, more focused, putting things into perspective, and realizing that our small little life, you know, have the little violin, it's nothing compared to what, say, Todd's physicians are dealing with. And all of those things are good things. And I'm wondering if you're thinking at all, how do we bring those good things forward? And how do we avoid what this article talked about, which is once this is all over and we get to this new normal, we might actually see this silent pandemic when people get to the point where they don't like the new normal. So how do we bring that forward? Maybe that it's just about creating access like you're all doing, or is there a specific program that you're focused on? Eva, you're shaking your head.
I would like to sprinkle that question with some of what is happening in the viral world around, you know, the good news from John Krasinski that people have latched onto. Are these kinds of solutions you are trying to look into embedding in as part of your solution in some shape or form? Because it seems like this whole nonstop either news cycle or the new normal that nobody likes is going to be rubbing against each one of us in a negative way. So what are you doing to kind of make things positive for folks? Yeah, I'll begin with Eva because you're on the top of my screen.
So I think there's actually two parts I want to address. I want to go back to something, Bambi, you said earlier about meeting with startup CEOs who are asking questions, how do I support my people? I made this assumption. It's one thing when you work in the healthcare industry, I just assume that people know things. And so I was sitting with a large client, and I wanted, they probably have 25,000 employees, and I had the privilege of speaking to 400 of their top female employees. And I'm sitting next to the head of benefits. And these are all bright, intelligent, well-educated women. And we're talking about the benefits and the importance of behavioral health. And a woman in the back raised her hand, and she said, and her question was, when will this company start covering mental health? And I was floored, because I know that we have mental health parity. I know that if you have medical benefits, I know that if you have behavioral, but it just struck me how much people don't necessarily know or think about that. So to the extent, and so kind of from a public service announcement point of view, to the extent that anyone has medical benefits, you have behavioral benefits. And I think I'm extremely proud of the innovations that Cigna's taking, and I'll highlight a little bit more on your the positive pieces. But that extends beyond Cigna. That's anyone. And so I know with Cigna specifically, if someone calls in and says, I need help finding a provider, we actually take on the burden of finding an appointment. So you tell us what you want, what you need, when you want it, and we will actually make sure we work with our providers to find you an appointment. So that way, trying to remove as much friction out of the system. There's also a lot of work out there on the digital tools, et cetera. So I just kind of put it out there as a public service announcement, because I tended to take that for granted, as opposed to going, wow, maybe not everybody does know that. From the positive side, I think when we are looking to innovate, I was saying this to someone the other day, is there's a lot of times I think very large corporations can kind of get mired down and things move slowly. The hesitation, will people adopt it? Will it not? What will it look like? And we've seen a tremendous acceleration within our behavioral network on a few fronts. Number one, we had in about the end of February, about 20,000 providers that were willing to do virtual care said, yes, I want to do virtual care, put it in your directory. In 1 week in March, we had 4,500, from 20,000 to 20, like an increase of 25,000 providers who volunteered, to the point that we said, no more. We will assume if you'll do it, we'll reimburse it. Check, done. Nothing else, because it was something that was such a great need. I'm also finding when we think about innovation and working with other digital partners, one of the areas that we're focused on is not so much I want to take to my employers and say, here's another partner to add on, here's another partner, you know, you've got these three, let's add on another one. Instead, we're looking for partners that we can embed directly into our behavioral health network. So there's 4 different partners that I would say over the course of the next 45 days, we'll be announcing that are directly embedded into our network. So that way employers don't have to choose, do I want it, do I not want it? Instead, if that's your preference for seeking behavioral health care, we'll make it happen. And so those are some of what I think are the positives that I think if COVID-19 hadn't happened, I think instead of 45 days, it would have taken 6 months.
Can you you don't have to talk about the names of those partners, but can you talk about the areas that they're in and what void they're filling?
Yes, so a couple of pieces. Number one, it's on providing all of our focus is on providing access to available care. So one piece is about enabling text therapy. So for us, a really important piece is it's not just, can I do brick and mortar face-to-face? Maybe your preference, maybe telephone, maybe video. If you want text therapy, how can we enable that? Another one really relates to substance use and how can you get virtual substance use care? So those are kind of to give you two examples of what we're looking at. So something more intensive and something that's more, I'll call it routine outpatient care. And it's really just filling in those virtual spaces.
And that's asynchronous text therapy. So anytime.
Correct.
Okay.
Correct. So in the moment you are feeling it, which is actually, I think, to some of the things that we often struggle with is, I'm feeling something, I want to talk to someone. I may not be able to talk to them, even if I can get an appointment in 3 hours, I may not be feeling the same way, but from an asynchronous text therapy perspective, I can text it in the moment I'm feeling it.
Great, thank you.
We did a survey, so I want to get back to this and everyone can speak after I share what I have. I'm not going to, I have to look for it, but we did a survey with everyone here, so a couple hundred, and they filled it out. And so I will give you the stats on that, the results on that in terms of their preference, in terms of texting, virtual therapy, in-person therapy, online games, meditation. So go ahead and answer, everyone else answer Archana's question if you're ready to do that. And I'm going to look for that survey.
So yeah, I mean, I would begin with Todd. And are you approaching with positive psychology your virtual care solution? And then also, I wanted to ask a question actually from both spectrum. How are you addressing the positive psychology and bringing shift in mind and thoughts towards positive, but also are you building in grief counseling, because that is the other aspect that is left unseen as people are losing family members. So they get grief counseling, but they are also friends and their extended network is getting impacted with loss. And that is a big kind of another kind of hidden pandemic in a way that's happening. And that's causing a lot of grief and pain. So how are you addressing that, especially in the setting of healthcare workers who are seeing possibly not such a positive outcome for some of their patients?
Yeah, I mean, the short answer is a lot of what we've already talked about. It's making it available through access, right? And a lot of that is virtual. So, one thing I would call out, and I sort of mentioned it or touched on it earlier. I think one of the unseen. So I have a caregiver on my team. I have a person on my team whose family's from the East Coast and had a close relative pass away, completely unrelated to COVID, but couldn't travel, couldn't be there, couldn't so use some virtual tools, but to be with family and loved one. But that sense of not being able to say goodbye and be there it's such a sacred moment for people that I think that's been maybe one of the biggest impacts we've had, is to be able to at least give folks the ability, and most people have their own device and we can set up connectivity, not just with healthcare workers, but their family. But if they don't, making sure that they have an iPad or a tablet. And that's just been a huge part of it. I think the other thing that we're doing is internally, as a very large employer, 120,000 employees, is being very proactive about telling the story and how and celebrating our caregivers. So in addition to giving them tools to be able to deal with the stress and deal with the PTSD and deal with the hours and the fear of exposure and lack of PPE, putting together montages and videos and celebrating. And so if you go by any of our hospitals, you'll see homemade signs that say, heroes work here, right? And so just some things that are very, maybe not digital, but some tools to really call out and celebrate the positive. And it's interesting because I work in my office all day on video calls, but it even resonates with my kids who are used to seeing me go to the hospital and see patients and be gone for long hours. And now I'm cooped up in my office, and but it resonates with my 8, 10, and 12-year-old that Papa's in there helping people, kind of thing. Or even if he's not seeing patients himself, he's setting up tools so that other doctors can see and help people.
Or playing video games.
Or he's doing that, yeah. Or he's on some webinar with some of his newfound friends.
It's 4 o'clock, so we have a question here I wanted to ask, but I also wanted to prep you guys for and think about another question as well, which is how do you take care of the whole person across the spectrum, specifically especially with you, Claire, at Headspace. I'm assuming that 75-80% they're there because they're sort of dealing with maybe mild anxiety, possibly, that meditation can address, but perhaps you're doing a number of clinical studies to even expand it for, you mentioned some people with comorbidities and chronic conditions. So, but hold on to that question, that's for everyone, but here's a question from the audience. There's a lot of discussion about the uptake of digital mental health. Besides Grow Your Own, a la Todd's concierge service, what is the appetite for new to market solutions? What would make them a viable solution for you to pilot during this crisis? I'm assuming that one is for Eva and Todd.
Yeah, so I think my response for us when we're looking at pilots, and there's a number of different pilots that we are exploring right now. I think a few things that are really important are, number one, if our goal is to address access to timely care, how does it solve that problem? And I think, Bambi, to something you asked, is like, what void is it filling in the system? So are you going after something very concrete, like I want to increase access to outpatient professional care? Are you going after something very distinctive, like medication-assisted treatment, substance use? There's some out there that are very specific to obsessive compulsive disorder. So, very much knowing what you're doing. I think, too, the ability to be reimbursed as a provider makes the hurdles a lot, makes the barriers to piloting, reduces the barriers to piloting dramatically. So I think those are two things to really think about when you're developing a pilot, that I know when we're looking for how can we turn something around quickly and make it available, those are pieces that really matter to us.
Yeah, well said. I don't know how much I have to add to that. I do think it also for us. And if you're thinking about a technology solution, we always start with, what is the problem we're trying to solve? Not, is there a tool that we can integrate into our system? And so really it does start with, thinking about it and then understanding kind of the workflows well before we would look for specific endpoint solutions. So I think that for me would be where you would start is there a need for this? Is it clinically viable? Is it safe and efficacious? And then, is there an ROI? And generally, if we're doing anything new, whether it's a digital tool or virtual tool, or I always ask 4 questions of my team. I say, is it safe? Is it as good or better than traditional care or in-person care? can we pay for it? Is there an ROI? And then number 4, is there a clinician champion who's going to wake up every morning saying, this is my mission and I'm going to make this work to, you know, do whatever, pediatric endocrinology or something by virtual visits. And if you have those 4 components, you have a pretty good chance of actually transforming care.
Great. Well, let's want to talk about the question that I raised earlier. Maybe Claire, you've thought about it a little bit, and maybe you can share your response now.
Sure. Can you jog my memory? You're asking, how do we serve the whole person?
Yes.
Or is this about positive psychology?
Yeah,
I think it's both. Yeah.
Yeah.
Yeah, absolutely. On the positive piece, I think, you know, that's probably the most straightforward, you know, way to look at Headspace. We're not, so I'll talk about it in 2 ways. One, Headspace has shown clinical efficacy for the alleviation of a variety of symptoms of mental and physical health. So we have a research portfolio that we actually have 75 active collaborations with university-based researchers looking at the clinical efficacy, feasibility, acceptability of Headspace as either an adjunctive to traditional care or in some cases a standalone intervention, particularly for folks in that subclinical range with mental health, you know, common mental health conditions. And increasingly also looking at the safety and efficacy of Headspace for the treatment of physical chronic health conditions. And that's really the aim of Headspace Health, which is a new digital therapeutic subsidiary within Headspace, where we're developing new services, digitally enabled services to support adults facing, managing stress-related chronic physical conditions. And as we know, certainly mental health comorbidity is the rule, not the exception with chronic physical health conditions. So as we move towards going to market with that product, our first step will be a clinical pilot trial and then a larger clinical randomized control trial looking at that new service. So all of that to say, you know, certainly there's a large body of evidence to demonstrate the effectiveness of a digitally delivered mindfulness meditation tool for the alleviation of really a wide range of clinical and subclinical symptoms. But all of that being said, one reason, frankly, as a clinician and scientist that I decided to join Headspace is that they don't take a traditional kind of clinical or medical model approach to the alleviation of those symptoms, right? So mindfulness meditation as a solution, as an approach, as an intervention, it is inherently whole person oriented, right? So I think a lot of times sort of the way people think about mindfulness meditation, at least in the West, is that this is something I have to do it when I'm stressed to calm myself down, right? And certainly it plays a role and has an effect in that context. But I think one thing we're seeing both pre-COVID, given the evidence that Headspace has generated, but also increasingly kind of through this experience and beyond it, is that I think, you know, we can start to see a shift in thinking that mindfulness isn't just a reactionary tool, mindfulness as a practice and meditation specifically, but these can also be preventive skill building practices that help us bolster our resilience to stress. And some of our fMRI research really gets at this hypothesis that the practice of mindfulness builds up that buffering mechanism so that even when we face really significant stressors, we actually have greater psychological and emotional resilience to those stressors and kind of have those skills we need to navigate those situations. So I think, you know, kind of by virtue of what the intervention is or what the practice is, it takes really a non-clinical sort of approach, right? And within the values of Headspace, play and playfulness, having a curious mind, courageous heart, these are core fundamental values of the brand. And so you see that playfulness, that focus on savoring, on joy, on kind of holding our experience lightly. That's really infused through the brand and through all the experiences that the digital experiences that we create for folks.
So you're creating more people who are not like Ava saw running over and buying anti-anxiety pills because these people are far more resilient. They don't need to do that, hopefully, that they can manage that stress or those panic attacks because they've conditioned themselves to be mindful.
Well, I would say, yeah, as a clinician, I would say we don't have any empirical data to show, you know, kind of whether we see a reduction in medication usage as a result of Headspace specifically. But the broader mindfulness literature would show some indication, yes, that you can see kind of reduction in utilization of other types of care as mindfulness meditation increases. I think it's a both and solution, to be honest. And that's one of the great things about a digital tool like Headspace is that we're not here to, you know, to cannibalize any market share. We really fill a tool like Headspace fills a pretty apparent gap in at least the US healthcare system, which is we don't do a great job of prevention. And it's not easy to access interventions, tools, skills, professional help, et cetera, when you don't meet criteria for a clinical diagnosis, right? Or when you're facing extreme stress or just emotional turbulence that is going to happen in the course of human life, right? So mindfulness meditation is by nature kind of destigmatizing, it's accessible. It's not about treating a particular condition as a practice, right? It's something that anyone with a desire to move through the world with less reactivity to kind of the stressors or the stimuli that they face in their day-to-day could benefit from. And I think that that's a really nice kind of novel approach to have within the broader healthcare system.
Yeah. And I agree on that. I think mindfulness needs to be taught in the 21st century schools. It's a life skill more than I would imagine, you know, other sciences to some extent. Some things that have become obsolete can be removed and mindfulness needs to be brought in from school settings. So then the brain is rewired differently. And I also feel that Headspace, I don't think it's a competition because the Cigna is the healthcare provider and insurer. So I think you're seeing the whole spectrum, I think, from intensity perspective. And on the top of it, each one of the intense patient and not so intense patient can benefit from the mindfulness.
Well, it would be interesting to hear, not to put Eva and Todd on the spot, but it'd be interesting to hear your thoughts on whether you would integrate Headspace or a meditation type of app, or maybe you're already offering something similar, but what do you see as the value of offering a meditation app and tool to your patients and to your customers?
So I'll go first. First of all, I will say I actually am a personal user of Headspace. So as Claire was talking, I knew exactly what she was talking about from the videos and the little daily updates that they have. So I'm a huge fan. I will say philosophically, everything that Claire is saying is right. And I actually like the way that you said it is it's not a competition. We're not competing for, who is the most behavioral needs person and let's compete for them. It's no, how do we make sure they get the right tools? And whatever those right tools are, I would say we very much believe that mindfulness is an effective tool to coping with stress and the stressors of life. As an example, one of the things that we do, two pieces that we do is relative to veterans and first responders. We actually host a free mindfulness group once a week for veterans and first responders. And we're actually starting one once a week for frontline healthcare workers. It could be those who are working that are nurses, doctors. It also could be those who are janitors, cafeteria. You're working in healthcare anywhere, just to have a group where they can kind of peer group come together and practice mindfulness. So the debate on whether or not Cigna offers an app, someone chooses it themselves, I would say is it appropriate, efficacious, we believe in it? Undoubtedly. I think those are how we offer it, or the digital pieces are some that, you know, I would say we circle back around regularly just to say, is this the right time? Is this what we want to do, or do we want to invest somewhere else?
So
Yeah. And we don't have an enterprise contract with Headspace, at least not that I'm aware of. We might, because sometimes things happen in our org and it's such a big place. But we wrap in a couple different digital tools that I would say we've done largely well, we've gone beyond the pilot phase, but we're using them, but not nearly enough. And I would just echo, Eva's comments and Claire both, that when you start looking at the stats in the US of the number of people that need this, there's plenty of space for a number of solutions. So for me, it's sort of a, raises all boats, if you will, right? It's kind of like the explosion of telehealth can only be a good thing for those in that space, because it is becoming much more the norm. And I think that same thing goes for Claire's work.
Maybe we should touch on, let's see, we have about 20 more minutes. Maybe we should touch on, this was a big topic for Archana and I at our last discussion. It was about cross-state licensure regulations and some of the sort of obstacles right now, maybe not so much for you for Headspace, but for the providers, and really enabling physicians to offer their services to all 50 states versus just the states they're licensed in. And what are your thoughts? And Billy, you can also comment as well if any of your portfolio companies are dealing with that. But there was a debate in whether these waivers or these lifts in regulations would be temporary or permanent. And I think the consensus was more that it would eventually be permanent. It just would take a long time. So any thoughts on sort of the obstacles right now that we're facing regarding virtual mental health services and increasing access to people, say in rural areas or areas where you don't have any providers?
Yeah, I'll go. I mean, this is something I live and breathe every day. It's a big challenge for us, going across state lines, and we're, like you said, we're currently serving 8 states, and each state has its own challenges. We have nationally made great progress with the FSMB, the multi-state compact for licensure, but it's not universal, right? So if you happen to live in an area where that applies, it's great, but it doesn't apply everywhere. I will say it's allowed us to scale the services much faster in the setting of this crisis. We've been able to take resources in one area, and it's interesting, as you've seen, you look at the demographics of where the crisis hit first. In Seattle here, we were the epicenter early on. We had the first case in the US that was documented, and then we had an early surge, and then it kind of marched down the coast to Portland and LA and the Bay Area. And then of course it hit New York. And so we were able to actually take folks and move them into Seattle and help from places like Montana and Alaska and Spokane, Washington. And then as things settled down in Seattle, we reversed that, and we've actually used Seattle-based providers to help other states. And so freeing up some of the state licensing has been a huge win for us to be able to do that and care for people more efficiently. I will say it's a very complicated topic. And when you think about, if you're in the state medical board, this is a source of revenue for those states to be able to make sure that they're assuring quality for state licenses and oversight of that. And each state has a different perspective. So it is very much going to depend on the governors and their in those state medical boards being willing to maybe use this crisis as a wake-up call for looking at this on more of a national scale than state to state, which would be, I think, wonderful for virtual care. And given that we don't have enough behavioral health coverage in this country, this is an area that could definitely benefit.
Yeah, I think it's 350 billion in terms of the medical board, how much revenue they generate across the country. That's a lot to give up.
It's a lot to give up.
Yeah, and considering that they're not providing patient care. So it's a layer of cost that our tax dollars are paying for.
Ava and Billy, did you have any comments regarding any of these hurdles, reimbursement hurdles or cross-state licensure regulations? Any regulations right now sort of inhibiting the expansion or acceleration of some of the services you'd like to get out there? Or Billy, your companies?
Yeah, I mean, I think a lot of it's happening in real time, and payers are trying to be responsive. And I was getting physical therapy on my shoulder, and they're like, we think we can get this reimbursed, but we don't know yet. I mean, so that's all happening. We're seeing with our companies as well as people are rolling out these new models, and there's sort of promises, but it's taking a bit of a risk. But I do think that there will be federal pressure, because there's people may have different views about our federal government today, but
really?
No. Yeah, but within CMS and CMMI, Center for Medicaid and Medicare Innovation, there's actually some pretty smart people that are there and been there, thinking about alternative care delivery models, and there are people coming from the startup world. So the former director is a guy named Adam Bowler, who started Landmark Health, which is a home care delivery model, and the current director is a guy named Brad Smith, who used to be the CEO of Aspire, which is a palliative care business that we backed actually at Oak. And so I think there's a lot of forward thinking there. And what they're saying is, what does the future of care look like? And how do we bring down the cost of care for the Medicaid and Medicare populations? And a lot of the commercial payers will follow that lead in certain circumstances. And so if they're saying, hey, we will allow for cross-state licensing and we'll reimburse for that in this crisis, or even outside of the crisis, there could be, I think some of those things will have staying power, because people will, as we were talking about earlier, people will like getting care at home. And they'll realize that it's cheaper overall for the cost, right? You talk about how you're going to lose revenue from the state licensing board, but on the other hand, if you can bring down the total cost of care for a state with, managed Medicaid or something like that, I mean, you're saving costs. So there's a lot to look at. And I think that this crisis, again, will accelerate some forward thinking, and a lot of things will find that they stay. I mean, even in sorry to keep going on, but even in the CARES Act, there were a lot of things that startups have been, or industry groups have been lobbying for, not necessarily connected to this crisis, but that had been sort of on the healthcare radar, that got pushed through because this is a way to lower costs going forward. So like things around direct primary care. So I think we'll see a lot of that coming out of this crisis. But Ava, I'm sure other thoughts as well to add.
Yeah, I'll just add on very quickly. From a payer perspective, if I just think philosophically, what is my goal? My goal is to get access for people in a timely way. So I don't really have skin in the game as to whether or not it's in a specific state. We have to abide clearly by laws, et cetera. So, to the extent that we can philosophically, we're completely aligned. I think part of the challenge that all of us have to overcome is, okay, so if we did it one way before, as we change, making sure, and I think Billy, you nailed it, which is, can we make sure our systems and our payments and everything else match and adjust as quickly as it needs to happen? So I would say philosophically, check. Reality of making sure it happens, that has, it's not for a lack of desire, it's just figuring out how to do it.
I have had somebody who just raised their hand with a question, so I unmuted her, and so she's there. If anyone can see her, Lindsay, do you had a question?
I think she's on mute.
She doesn't want to talk in the chat. She's saying, no way, Jose.
Okay, I will, okay, then I will find you. And well, her question is, this is why I wanted her to ask, because I guess everyone can see this, at least all the panelists can see this, regarding spiritual practices impact on mental health. I'm sure you're seeing a lot of this in Headspace, Claire, and you've already talked about having a lot of clinically validated research. So can you maybe talk about one or two studies that show the effects of meditation? Positive
Certainly.
impact. And you would consider those spiritual practices, right? I would.
Not Headspace. So it's a great question. You know, certainly meditation is a fundamental part of many different spiritual practices, and so obviously that's part of the heritage of that practice and the lineage. But mindfulness, as you know, as a skill, as a practice, is not spiritual in nature. And that's particularly true in the ways that mindfulness shows up typically in the West. So a great example is some of the work that's come out, you know, John Kabat-Zinn being one of the kind of Western leaders in the mindfulness movement. Really all mindfulness means is paying attention in a particular way. At Headspace, we talk about that attention having the qualities of both awareness and compassion. Other people define that type of attention as paying attention in the present moment on purpose, non-judgmentally. So there's different ways to define it, but it's really a practice of applying attention in a particular way. So certainly there is meditation, and different types of meditation exist within spiritual practices, but that is different from the way that mindfulness is taught in a Western context and in a healthcare or mental health context. As far as Headspace research goes, we have, I believe the current number is 27 peer-reviewed published papers looking at Headspace as an intervention for the alleviation of symptoms across a variety of areas. So that's both symptom reduction. So we have, for example, one study that we conducted in an enterprise setting with a large technology employer looked at a reduction in clinical symptoms of anxiety and depression. Also, as a part of that study, we saw reductions in blood pressure. So we look across mental health and kind of physiological outcomes. But we also see kind of the promotion of more kind of positive skills or positive traits. So one of my favorite studies of ours showed that practicing mindfulness with Headspace for only 3 weeks led to an increase of compassionate behavior by almost 50%. And that was measured in a social psychology paradigm where I won't get into all the details, but social psychologists come up with the best experimental paradigms and really looked at not how do people report they feel in terms of feeling compassionate or having compassionate attitudes, but looked at actions that indicated their desire to reduce another person's pain. So we look at both. We look at Headspace as a way to reduce symptoms, to bring down kind of to manage pathology, but then also to amplify or increase kind of those pro-social positive behaviors or positive attitudes.
Does anyone want to comment on that specific question? If not, we have 3 more questions here.
Yeah,
so
we have 3 more questions that are popping up, which are quite interesting.
Yeah. Do you want to read that one,
Yeah.
Arshna, top one? And maybe since we have about 5-6 minutes, whoever feels they have a really good answer to that one, they can share.
Yeah. I like the question quite a bit because I think that's everybody's trying to solve. What's the biggest barrier to more broad distribution of virtual mental health access for Americans, and how to overcome it? It's a mouthful, but if you can at least identify what's the biggest barrier and what are your top ways in each of your organizations that you feel that we can overcome it. I'll begin with Bill.
Eva.
Okay, go ahead.
Go ahead. I'll be quick. The biggest barrier to me remains to be stigma. We have not overcome at all people being willing to get behavioral health care. When I'm physically ill, I hurt, I go to the doctor. When I have symptoms that are percolating in a behavioral health space, I may or may not get care. So I don't necessarily view it, especially for professional outpatient care, that it's so much that it's not available. It's still people being unaware of how to access it. And I think creating the ability to know it's there is hugely important, but I would not underestimate the impact of stigma.
And
excellent, thank you.
I might add on to that. I think stigma, then I think access to care and availability of providers, and then availability of providers that are affordable, and there's reimbursement for that. And there have been, it's, you know, if Claire wanted to go practice, right, in LA or the Bay Area, she would look at what she would get reimbursed from the payers, and then she'd look at the demand for her services. No offense to all the payers out there, but they'd look at she'd look at the rates, and it would be night and day, right? She'd maybe $100, for a doctorate level practitioner, and versus she'd go charge 200, 250, right? And so the incentives aren't there. Now that's changing, and we're seeing more and more, payers, and this is with the companies I work with, saying, we want to build a network. We recognize that there's not the availability. And the answer is, okay, well, you guys got to reimburse higher. They say, okay, we will, if you can provide a network. So it's going hand in hand. And so I think as we're starting to get more sort of locums of providers, not necessarily just the individual practitioners, but larger groups, it's easier for the payers to say, okay, we can see outcomes with these providers. There's quality control. We can reimburse at higher rates. They're getting that demand from their customers, the employers and the individual members. And so they're saying, we want access. So they're saying, okay, if we're all, Cigna's competing against United or Aetna or whomever. And they're saying, well, we got to keep this customer. In order to do that, we have to have a network. In order to do that, we have to pay. And so that's going to create more access, as all the stigma, meanwhile, is lowering as we, I think more and more and more. So I'm optimistic, but it's sort of a flywheel that has to happen, and a lot of pieces need to connect. So that's my 2 cents.
Yeah.
Hey, Billy, philosophically, that was really well said. I would completely agree with your assessment.
And I'm sorry, I somewhat missed that because my son was behind me asking me if I wanted a blueberry muffin, and so I had to kind of shoot. This is what happens when you're.
The answer was fine, but the blueberry muffin sounds better. So yeah, you made the right choice.
So we have somebody raising their hand. So let's go to that, and I'm going to allow this person to talk. So hopefully he'll be okay to do that because he's raising his hand. Go ahead, Randy. You're on.
I think you're muted.
No,
Randy, you're still muted.
She's still muted?
Yeah.
Unmute. Permitted. I think you can talk now.
It still shows the mute button.
Mute audio. That's strange. Okay, unmute audio. I'm sorry, Randy. Maybe you can
type away.
Yeah, maybe you type away and we'll just go to a question. Let's go to a question, Arshana.
Oh,
yeah,
she's unmuted.
I think she's unmuted now. Something you did that worked.
Okay.
Randy, go for it.
Randy, you are unmuted.
Oh, so the question has already been answered, so never mind. Thank you. So this is a question from Mitul Desai for Eva, Todd, and Billy. Are you seeing innovation in treatments for those with serious mental illness, especially schizophrenia and bipolar? For example, not just on virtual care, but also in other areas like community-based or that incorporates social determinants of health. So in that order.
Yeah.
So I would say
I mean,
I can't point this.
Definitely seen companies.
Oh, go Billy.
No, please go ahead. Go ahead, Ava, please.
I was just going to say, I can't point to specific innovations and say this is what we're seeing. What I will comment on that we're seeing a lot is the focus on social determinants of health and how that has to work hand in hand with behavioral health needs. So you may have a behavioral health need, but if you can't get appropriate access to food, shelter, financial support, et cetera, the dream of dealing with your behavioral health condition becomes really hard to achieve. So I would say across the board, that's something we're looking at. I think there's almost this impression sometimes that we deal with employers where they'll say things like, oh, well, social determinants of health, that's really my population's problem. That's really a Medicaid problem, and it's not. It impacts all employers. So it's something that we're trying to elevate just across the board, not just for serious mental illness.
Yeah, totally echoing that. on a couple levels. So, first of all, on the SDOH part, it's massive. We're investors in a company called Unite Us, which has a really cool role in all of this, where they're serving as air traffic control effectively. So, a payer or a state is saying, we want to make sure that our population is getting access to these social services, but we have no idea if it's happening or what's efficacious. And they're serving as air traffic control, linking with all the service providers and the payers and saying, we can sort of track to make sure that the folks are actually getting the care that you want them, whether it's food or shelter or job or whatever it might be. And so I think they're doing great. And I think it's because there's so much focus on this from the payers saying these things are all interconnected and it's not just, they've said for the Medicaid population. And then to your point about sort of, more acute treatment, I think that is a really it's not talked about quite as much. There's, a lot of people talk about depression, anxiety, but less on sort of these highly acute challenges. And there are treatments, you alluded to sort of community-based. There's a lot of very fragmented people in individual communities who provide these services, but they're not connected very well. And it's something actually I've been thinking about a lot recently, is how can you sort of create a model that goes into these various communities and create sort of a scalable, repeatable model focused on delivering that higher acuity care in the community rather than in very expensive treatment environments. So it's an important area, and I think there's increasing focus on it.
Should we go to the next question?
Yeah, you want to go, Bambi? You want to go for the next question?
Yeah, I guess this is for anyone. What is your opinion about the integration of digital mental health solutions like digital CBT and Headspace to the offering of virtual first primary care providers like Galileo or Firefly Health?
I can speak to that one a little bit.
Okay.
So I think, one thing, just to the conversation before, this is relevant to some of those barriers to mental health coverage. I think integrated care, so integrated primary mental health care delivery, is a really important solution to addressing challenges of access to mental health care. So to that end, then thinking about how do we enable primary care providers to address mental health and behavioral health challenges in an effective way. One thing we know across the literature and just across kind of being in healthcare is that while primary care providers are really the number one delivery mechanism for mental health care in the country, they don't feel equipped to handle mental health concerns. It's not super emphasized in primary care training. They're not mental health specialists. And so we see great data really across the field when you integrate mental health care into a primary care setting, particularly using evidence-based models, where mental health, the relationships between the mental health providers and the primary care providers are structured in particular ways, and those warm handoffs are in place. You see great outcomes when care is delivered in an integrated fashion. So I think that leads very naturally to, a lot of activity in the digital space to try to understand how can we extend integrated care using digital behavioral health as an adjunct to that primary care service in an effective way. We've done some work in this area at Headspace, where we work with a major integrated delivery network, where Headspace is one of many different digital solutions that can be offered at the point of care by primary care provider, and also in some implementations, we do this within specialty mental health care as well. But we see great uptake, we see better than average engagement, we see provider satisfaction. So, I think there's a lot of players in this space that are specifically around digital CBT or digital mental health care in primary care or in specialty mental health care, but it's absolutely a model that, it makes sense philosophically, it makes sense technologically. There's specific barriers, that you need to kind of work through, and that often has a lot to do with how is this implemented, how is this communicated to providers, how does reimbursement work, what do those payment structures look like? There are a lot of questions there, and given, Billy's experience with Quartet, I'm sure it could speak a lot more to kind of how some folks are thinking about that. But from the mental health side, I think it makes a lot of sense. It's a great way to think about getting around stigma, expanding access. And certainly I think with the growth in virtual care, we're going to see a lot more of this.
Great. Billy, did you want to touch on Quartet, or since?
Yeah, I mean, I just think there's more, across the board, whether it's Galileo or Firefly or Quartet or other companies in our portfolio as well. I think there is more integration happening between mental and physical health. I think there's just a greater realization. I think everyone's realizing everything's treated better if it's not in a vacuum. So, for a company like Quartet, it's identifying patients with comorbidities and saying, oh, this person has, diabetes and depression, and they keep on crashing and ending up in the ER. But if we could treat their depression, perhaps then they would take their insulin, they wouldn't end up in the ER. And so it's, how can you treat these things in tandem? And, Galileo and Firefly, digital first primary care businesses, saying, okay, well, how can we treat the whole person and what services can we add on? I think that's totally where the future is, and seeing it there and at other companies as well. So yeah, totally agree with Claire's perspective.
So it's 4:37. We've actually gone on the full 90 minutes, and I think we need to be cognizant of everyone's time. But if you need to hop off, then let us know. I did want to ask Billy one last question, because this is also a little bit about innovation and financing our innovation. And I'm wondering if we've talked about the new normal with regards to our mental health. What about the new normal when it comes to venture capital and financing deals? Are they going to be more localized? Will you, will you have a different cadence? Will it be slower? I mean, I've seen a lot of investments happening, but I'm wondering, is there a change, do you think, in this new normal for startups?
Yeah, I mean, it's a question. It's a great question. I think, look, there's so much uncertainty right now. People don't really know exactly what to do or how to price things. And, meanwhile, like the equity markets have largely come back. And so while you have massive unemployment, so things are really out of whack right now. I think that, if you have a great company that needs financing, you don't want to go out and raise at a big discount. So maybe your existing investors will sort of tide you over a few months to sort of see how things unfold here. And then, what happens going forward, it just depends, I think, how the market unfolds. There's still so much capital and funds that have been raised that there's plenty of capital that needs to be deployed. And I think people will be looking to do that. Now, if you're out raising a fund right now, that could be tougher, especially like institutional investors, need to say, okay, now I'm over allocated to private markets, and how does that change things? So there's a lot that could happen in the fund market that could determine how much capital there is, which will determine supply and demand for making investments. But I think, if the equity markets hold up and there's more of a V bounce back, maybe things return more quickly. I do think there'll be sort of a cut in valuations to a certain extent and a slowdown in funding. We certainly see that. But I don't think it's going to be a massive reset on how people approach the market, just because there's still so much capital out there and people looking for great companies. Great companies will always get funded.
Great. I think as Governor Cuomo said, it's not we're reopening the state or the country. We should reimagine the country. So in an optimistic way. So just reimagining in a positive way. So I think, does anyone have any last words that they want to share? If not, then we so appreciate everyone's time and really exploring some of these questions that are weighing on a lot of people, and really being out there on the front lines, like Todd and Ava and also Claire and Archana, who is sort of like the head of the COVID task force for I don't know how many companies, but it is really a lot of weight on your shoulders. So I think I speak for everyone that we all appreciate that. So I want to remind everyone that we do have another virtual breakout session that is on May 7th. And then we will have our speakers join us once again on May 27th live between 12 to 4 p.m. Please go on to vader.tv/events to see the times they will be on, because we will not have them on for 4 hours straight. They will have their time slots. And we really are looking forward to seeing them again. And I would just say, everyone stay healthy and purposeful and safe. And Arshana, any parting words from you?
Yeah, so I mean, I personally want to part with saying that and sharing that I do my mindfulness through art. So if you can all share how we are doing our mindfulness practice, and with that we can close. I'm going to pick on Ava again because she's in my right upper corner.
Oh my.
Yes.
Well, I will actually do a plug for Claire and her Headspace, because I have been using them for, oh gosh, probably 3 years now. And I am very, very thankful for that.
Excellent. Thank you. How about you, Todd?
You know, honestly, I've learned a lot. So anytime I'm on a panel and I learn a lot, I'm always enjoy it. So, you know, thanks for having me. And I know I was sort of quiet in the last couple of questions, but I think Billy and Ava nailed it. I think there's a provider shortage in this space, and it's going to continue, and we have to be creative at how to solve the problem together.
So how do you chill out? That was the question.
Sorry.
Yes.
Sorry, good question. I'm mainly, we put in a basketball court in our yard last year. And so in between meetings, I try to run out and shoot some baskets with my kids.
Excellent. How about you, Claire?
Yeah, well, certainly user of Headspace, but that's too easy. So I will share, mindful movement is really, like, when I really need that stress relief, that's what I go with. So whether that's exercise or yoga, something in that range.
Yeah. How about you, Billy?
Trying to find 5, 10, 15, 20 minutes to meditate if I can. That's the goal every day.
Excellent. How about you, Bambi?
It's somewhat mindfulness. It's sort of a collaborative sort of mindfulness, something that we've done every night. And I'm cooking dinner every night, which is a new thing for me.
New normal.
All my kids are home, so I'm very domesticated starting around 5 o'clock because I'm cooking meals. But one thing that we have done now, we've been our 5th week on doing this every night, and I have 4 kids and a husband. And so every night we share what we're grateful for that in that day, on that day, and we share an accomplishment. And so we have done that every night, and it's been quite wonderful and very great for the kids to focus on just being purposeful and grateful. Thank you for asking that question. All right, guys, I guess we'll wrap it up there. Everyone have a great evening, and we will see you at the next session.
Thank you.
Thank you.
Good night.
Thank you.
Bye.